Welcome everyone today to this webinar, and again this is AIOS Masterclass and one of the unique webinars. This is AIOS Masterclass, What is Possible After Ophthalmology Residency, by none other than Dr. Gullapalli N Rao, who's the founder chair of LV Prasad Eye Institute. I think he doesn't like very long introductions, but still I would like to introduce him. It's a privilege and honor for me to introduce Dr. G.N. Rao, whom for the first time I saw as a postgraduate student in World Congress Cornea, the only Indian who was presenting that way back in 1990s. After a successful career in US as an academic ophthalmologist in 1987, Dr. Rao established LV Prasad Eye Institute in Hyderabad 31 years ago and is the founder and chair of that institute. He received his basic medical education in Guntur, Andhra Pradesh, and completed his postgraduate residency at RP Center for Ophthalmic Sciences, All India Institute of Medical Sciences, New Delhi. He trained in US at the Tufts University School of Medicine in Boston and later at School of Medicine, University of Rochester, where he continued on the faculty until 1986. He's one of the very few who returned back to his country after staying abroad to establish LV Prasad Eye Institute at Hyderabad. His academic and research achievements surpass everybody else's, but just to name a few, he has honorary doctorates from University of Melbourne and University of New South Wales, Australia, Dr. NTR, University of Health Sciences, India, University of Bradford, UK, and GITM, University, India. He is the president of Academia Ophthalmologica International and this group of 80 of the most eminent academicians in ophthalmology in the world. He's visiting professor to many universities in US, Europe, Australia, and Asia. He's published more than 300 papers in the peer-reviewed international journals and is on the editorial board of several international journals of ophthalmology. He is the fellow quas surgeon of the Royal College of Physicians and Surgeons, Glasgow, fellow of two of the Science Academies of India, and fellow of National Academy of Medical Sciences. He's been the former Secretary General and later Chair of the Board and CEO of the International Agency for Prevention of Blindness, in which he played a pivotal role in developing and fostering global initiative to eliminate avoidable blindness along with the WHO Vision 2020, the right to sight in partnership with WHO. He's been on the board of trustees for International Council of Ophthalmology and at leadership positions in many national and international eye care organizations. There are several other awards and honors to his credit, which include the Newman Award from ICO for Outstanding Global Leadership in Eye Care, Bernardo Streif Gold Medal from Academia Ophthalmologica Internationalis for contribution made to advancement of ophthalmology, Kufer Award from ARVO for outstanding accomplishments as a researcher, ophthalmologist, and humanitarian, Jose Rizal Medal from APO for outstanding contributions to eye care in the Asia Pacific region, World Cornea Congress Medal from International Cornea Society, amongst the first 10 for outstanding contribution to field of cornea, International Blindness Prevention Award from American Academy of Ophthalmology, Prasad Award by the Lighthouse International New York, Outstanding Humanitarian Services Award from American Academy of Ophthalmology, Arvo Alcon Keynote Lecture, and Barry Jones Lecture of the Royal College of Ophthalmologists, UK. He has received 3 awards from the AIOS and the Asia Pacific Academy of Ophthalmology, and also the first Association of Eye Banks of Asia Award at the Asia Cornea Society Scientific Meeting of Asia Cornea Foundation. He was inducted into Ophthalmology Hall of Fame at the meeting of American Society of Cataract and Refractive Surgery in Los Angeles, which is a very rare fate for anybody from India to achieve. He was inducted as Commander, Order of the Star of Africa for distinguished services to Republic of Liberia and to Africa in public service and sciences by the President of Republic of Liberia. And also he's the Lifetime Achievement Awardee by the All India Ophthalmological Society. So welcome Dr. Rao to this webinar, and we hope to have a great lecture and deliberations and interactions.
Thanks so much, Mahipal and Namrata, for those generous introductions. Most of it is a little bloated up. Mahipal, yes, you're right. Mahipal then went on from recognizing the epithelial defect to go and work with one of the greatest contributors to the understanding of corneal epithelium, Mike Lemp, in Washington, and he did his fellowship there. And Mahipal always told me during those days in Washington, whenever I ran into him at meetings, that he was going to replicate LVP in Delhi. So I said, why LVP? You should do LVP plus. And, so that's what the next generation people should do. We should go beyond LVPs, beyond RP centers, beyond Sankar Netralayas, beyond Aravinds. With each generation, it has to get better and do more. So that's the way for progress. But anyway, thank you so much. And what I want to do is, my presentation is going to be kind of bits and pieces, giving you a few messages. And I've spent only 15-20 minutes on that. But I want to leave most of the time for you to ask me questions, and I'll try and answer to the best of my ability. Okay, let's share the screen now. Okay, those of us, when we are in the residency program, quite often we don't know what to do after the residency, particularly in our country and in many developing countries. Whereas in the West, for example, they are prepared. They usually plan these things 1 to 2 years in advance. They are very clear, most of them, if not all of them, about some important questions. Or am I going to pursue a practice route or an academic route? Or do I combine the two if at all possible? What is the aim, long-term plan? And they also quite often look at where do I want to be 5 years from now, 10 years from now, and what impact do I want to make? So some of these quotes are very inspiring. Those of us in the medical profession have to remember these kinds of things more than anybody else, I guess. I feel very sad these days when I see in the newspapers harsh criticism of our medical community and hospitals. But we should overcome, and we can overcome those kinds of criticisms. And this quote is very powerful. One of the greatest values is the belief that the best investment any of us can make is in the lives of others. As physicians, we have immense opportunity to do this, impact the life of others, and through them the communities, and cumulatively nations and the world. When I look back at my own journey, and I asked myself the question, what was the background for me to initiate the LV Prasad Eye Institute? What all helped me? Inspiration from many institutions and individuals. Experiences throughout my life and exposure to different environments. The motivation to do something different and more. And of course, the support all the way from my spouse to the family, to the friends and the world, wider world. Each of them have contributed. And for most of us, in varying degrees of combinations, the same things matter when we build our careers and we lead our lives. I was inspired by many, many individuals and institutions, and I was fortunate to have had the opportunity to work with some of them directly, some of them indirectly, some of them through reading about them. But by all means, each of those stories was very inspiring. Here are two institutions in America. The left one with the old tower kind of structure is the famous Johns Hopkins Hospital, where we have the world famous Wilmer Eye Institute. The founding story is very inspiring. Ada D'Acosta Breckenridge was an young socialite living on Long Island, New York in the 1920s. One day while she was on the beach on Long Island, she started seeing colored halos and then blurred vision. And she went from one ophthalmologist to the other. Various diagnoses were made and treatment was given, but none of them helped her. Finally, at a social gathering, she ran into a British parliamentarian who told her that she was in Washington, D.C. to seek eye consultation from an ophthalmologist in Washington. And she asked him about that ophthalmologist, and he encouraged her to go and seek consultation from that ophthalmologist. She went to that ophthalmologist. He diagnosed that she had glaucoma and she needed surgery, performed it, and she got complete relief from her problem. That doctor was Dr. Wilmer. And she then thought, this enormously talented individual is sitting in this corner of Washington, D.C., many people not knowing about him. His name should be recognized and brought out. And she asked him for the list of all his patients, and he refused to part with it. She later on smuggled that list from his secretary, and many of the people on the list were American millionaires. One of them was the famous Andrew Carnegie Mellon in Pittsburgh, the steel giant, steel billionaire of those days. She wrote a letter to him, sought an appointment. He gave her an appointment, but when she went there, he wasn't there. But the secretary said, he left an envelope for you. She refused to accept that envelope, insisted on another appointment, finally met him and convinced him. And he told her in 1924 that he would give her $2 million if she could raise the matching money. She went about, raised the matching amount, and got the $2 million from him. And with that $4 million, she started the Wilmer Eye Institute at Johns Hopkins. Inspiring story, isn't it? And on the right is the famous Bascom Palmer Eye Institute, voted consecutively for the last 15 years or so as the best eye institute of the US. And this was the creation of an ophthalmologist leader, Edward Norton. He was inspired by all the institutions. He was at the Massachusetts Eye&E Infirmary, Harvard, on the faculty of that institution after having completed the training there. And then he got the offer from the University of Miami to move to Miami and become a professor. When he moved there, he saw an opportunity and went on to build the Bascom Palmer Eye Institute, the name of a football player from Miami. Dr. Norton mobilized resources, gathered some of the brightest youngsters in American ophthalmology to be on the faculty, and created this institution. So that again is an inspiring story. Closer to home, my first inspiration obviously was by mentor, from whom I learned the alphabets of ophthalmology. In some sense, the basics of living and succeeding and flourishing. And with the discipline that he instilled and the values that he instilled, I gained a lot. And that made the rest of my career, my professional career. Another inspiration was Dr. Venkataswami, the founder of Arvind Eye Care System. I was fortunate to have known him most of my life. Dr. Venkataswami and my father, who was an ophthalmologist too, were colleagues at the Madras Egmore Eye Hospital in the late 40s and early 50s, and we were neighbors in the assistant surgeon's quarters. So I knew him, I knew Nachar, all these people from Arvind system since I was about 5 years old. And he has always been a source of inspiration for me, more so after I got into medical college and then into ophthalmology. And he was one of the first people who was all set to help us, guide us when I decided to return to India and start an eye center in Hyderabad. So here's his story again, was a saga of inspiration. A man who built an institution post his retirement from government service. Again, discipline, focus were his secrets. The other person who showed us in India that subspecialty development and building it and practicing it successfully is possible was Dr. Badrinath of Shankar Nethralaya. When I was a house surgeon, during the year I was a house surgeon in RP Center, Badri just returned from the US after completing his residency and fellowship with world famous Dr. Charles Capels in retina. He came there looking for a job. Professor Agarwal actually told him that I would create the position. He joined as a pool officer now, and then we'll create the professor of assistant professor and then take you. But in the meanwhile, he went to visit his native place, Chennai, and from there, people there convinced him that he should stay back and build his own thing. So it was RP Center's loss, and again for Chennai, and that resulted in the creation of the now famous Shankar Nethralaya. Here is another gentleman who has inspired me since my medical student days, and perhaps responsible for me aspiring to make research as part of my career. The Professor Ramalinga Swan. He was one of the renowned pathologists in the world in his days, one of the leading medical scientists of India ever, former director of the All India Institute of Medical Sciences, and then former Director General of ICMR. He was always an inspiring figure. During my medical college days, he came and delivered a lecture at our college. And that lecture turned the switch on in me. That day, without knowing even the spelling of the word research properly, I have decided that I should pursue research. And later on, several times, I met him. He inspired me. He encouraged me. And when we returned, he was fully supportive of that. And what an inspiring figure he was, a tall figure in Indian science and Indian healthcare. So when we think of what is possible after ophthalmology residency, traditionally, we think of, most of us, if not all of us, clinical practice. But there are so many other possibilities. You could be an academic leader. You could excel as a pure clinician, nothing wrong with that. You could be an excellent ophthalmic educator. You could be somebody who get into public health and create impactful programs, both nationally and globally. You could get into cutting edge research, and you could also be a leader in developing eye hospitals and eye health programs and lead them. Whatever you do, what you should aim for is to excel and focus in whatever you do. Clinical ophthalmology, very few can stand out as exceptional clinical ophthalmologists. And you should aim to become one of the few. And certainly a large percentage of us end up becoming clinical ophthalmologists, but only a minor fraction really move to the top among that. And you have to get inspired by such people, get to know them, learn about them, try and learn during your residency as much as possible. Not only the technology part and the surgical techniques, but also the knowledge behind all those techniques and technologies. Once you have that combination and you continue to update your knowledge, you become a very competent clinical ophthalmologist. You can also be a clinical plus. Very few of us, hardly any, very small minor fragment, would like to give up clinical work completely. But where you can become an academic ophthalmologist, that means, by that I mean clinical plus in varying combinations. It could be clinical plus education, clinical plus research, clinical plus public health. And these are beautifully done even among Western countries in the US. Not so much even in Europe or Japan. But US universities encourage that, and they give you dedicated time to pursue these other areas in addition to your clinical responsibilities. The same thing is possible for us in India. America is kind of languishing now, and now is the time for us to fill that gap and space from India, and because we have the wherewithal to fill that gap. So some of you can combine your clinical practice by becoming educators. Some of you may want to pursue research. Research doesn't have to be complicated. Don't get scared by the word research. If you learn to document every single medical record in detail, when you are seeing your patients, each one of those documents will become a research document. Out of that analysis of those number of cases that you see, you can come out with new knowledge, new techniques, and suggest the development of new technologies. So clinical practice done well will make you a much better clinical ophthalmologist, provides you pieces of information and documents for excellent clinical research. And then those of you who have the aptitude for laboratory research, by all means, you should pursue it. I suggest, and I hope in future, our academic programs and residency programs will allow for a few months of rotation in basic research laboratories for those who are interested in pursuing basic research post their residency training. Short of that, before you jump into residency, you could probably go and spend a year in a basic research laboratory or post-residency a year and see how you end up liking it. But if you like it, I'm sure I can tell you, you will really enjoy getting into basic research. because we have the unique ability as clinicians. When we deal with the problems, out of those problems, we can create questions for research. And when you're also a researcher, you can immediately pursue the questions and try and find the answers and the solutions. So clinical plus research is a powerful combination. There are some of us who combine all these three: clinical, part teaching, and part research. In research, the most difficult part and the one that requires utmost discipline is to sit and write the manuscripts. I would say from your residency days, try to get into the habit of learning writing. If you get into the habit of writing from now on, and you slowly improve, by the time you complete residency, you will be ready. Or you can get into public health and pursue similar interests. I can give you stories of some inspiring stories here of people who combine these so well. I don't know how many of you know the name Herbert Kaufman. Herb was a pioneering cornea specialist, one of the most brilliant people that I have ever encountered in my life. Herb, when he completed his medical school at Harvard, went and spent a couple of years at the NIH doing research. And then he got residency training admission at the Massachusetts Eye and Ear Infirmary, ranked #1 program at that time. And the first day he went there, he went up to the chairman, Dr. David Kogan, and asked him, Dr. Kogan, unless you give me my own laboratory for me to conduct research while I'm doing residency, I'm not going to take up that spot. I'm going to another university where they will offer me my own lab and my own research facilities. That was the confidence he had when he approached the chairman of the department of Harvard and demanded that. And Dr. Kogan readily agreed and provided him that facility. With that, Herb, during his third year of residency, discovered the treatment for herpes simplex keratitis. That was IDU. Another example was Bernard Becker, the famous glaucoma legend. Becker and Schaefer glaucoma book, many of you may have read. And Becker was a resident at Wilmer Eye Institute. And during the years of his residency, he discovered the treatment of glaucoma with the Diamox. So there are many such stories and simple observations. I was telling you, clinical observations, how they make strong research base. The example of Morton Goldberg, who later on became the director of Wilmer Eye Institute. Mort apparently used to draw every single blood vessel on the conjunctiva in the medical documentation in all his patients. That's how intensive he was in his documentation. And when he was doing that, after a few years, he have found some interesting phenomena, corkscrew blood vessels in some of the patients, conjunctiva. And that roused his curiosity. He went and pulled all those medical records. And when he analyzed them, out came and looked at the retina of these patients. Out came the sickle cell eye disease and the sickle cell retinopathy, which he described again as a resident. Simple clinical observations, rigorous documentation led to that description. So just imagine, every one of us have such opportunities. And I keep on challenging our residents and fellows, when this happens in America, why is it not happening here? Why can't we do it? Just have to be focused and have the discipline to do these things. Yet another area where each of you have immense opportunities is an ophthalmologist manager. either clinical or general management or other kinds of research management and other skills. Some of us have the aptitude to do these kinds of things. And by all means, you should pursue that. In addition to your clinical practice, and after a few years, one might choose to become exclusively an ophthalmologist manager. And finally, this special group of people, the ophthalmic leaders, these are usually academic ophthalmologists with aptitude for management and can look into the future and envision the future and develop strategies for the future, the visionary people. And several publications in the business literature in America have shown among all the successful medical centers and hospitals in the US, the ones led by medical leaders were the most successful, not by Harvard MBAs, but by the medical leaders. So ophthalmic leaders can become very successful entrepreneurs. Mahipal Sachdev, there is a great example of that. And I often talk about us becoming 3H ophthalmologists. To become good with our hands, acquire knowledge using our head, and use our heart to become a real physician. And that combination, I say, if you just are good with your hands and not with other things, you are an average ophthalmologist. If you are good with your hands and head, you are a good ophthalmologist. If you have all three, you become excellent ophthalmologist. If you combine those with ethics and values in whatever you do, you become an exceptional ophthalmologist and a real physician. As we move into the future, the knowledge and technology, a lot of it will be taken over by the technological innovations. And we may not have to remember too many things. But what is going to make a difference is the caring physicians, the real physicians who care for their patients, those who have the caring attitude. They become exceptional doctors and they make all the difference. And throughout your life, our parents give us some values. Through our teachers in schools, colleges, medical schools, and residency, we acquire some values. And by the time we get out of residency, we have some foundation of values. Whatever values you acquire through your exposure, experiences in life, stick to them. Don't keep changing your values. A value-based individual as well as a value-based organization are the ones which sustain much longer, very successfully. We also have not only, I'm just throwing this pyramid not to talk about LVP, but just to show a model and the opportunities. Our opportunity is not just limited to the tertiary level care. Most of the ophthalmologists will have to practice at the secondary level of care. That is mostly cataract surgery, diagnosis of disease and medical treatment, some lasers, etc. So whatever we do there, we have to equip ourselves to become a good, comprehensive ophthalmologist. So by the time you finish residency, you should acquire skills to do all this in a safe manner with good patient care outcomes. And above that, of course, some of us who pursue subspecialties and academics go into tertiary and advanced tertiary levels. And there are opportunities for you to innovate and develop a cluster of secondary centers. You're working in tertiary centers, you can mentor either your own or somebody else's secondary centers and help them upgrade their quality, do their capacity building, train their people, etc. Similarly, there is a lot of opportunity now, particularly came to light and prominence through the pandemic over the last 2 years. No longer will the eye camps survive in the future. We need to have permanent facilities in the remote rural areas, primary eye care centers. And you should understand the concept of these primary centers, learn how to create them and run them as part of your own practice, or you link up with a cluster of primary and secondary centers. So in all this, you have an opportunity to innovate, to create, to help, to mentor. These are the 10 functional segments of LVP. So I'm showing this just to show you the opportunities we have. Each one of these areas is an opportunity for you when you come out. Clinical care, of course. Eye banking, for those of you who want to go into cornea, it's a huge opportunity. India is on the verge of expansion. While we have made rapid strides over the past 2 decades, we still have a long way to go. One area that we have neglected and continue to neglect, unfortunately, is the vision rehabilitation. Here again, some of our ophthalmologists, if you develop interest, can become leaders in addition to your clinical practice by providing those with permanent vision disabilities with appropriate care and realize their full potential to function like normal sighted individuals. As I already alluded to about education, you can help other organizations in their capacity building. Research, of course, rural and community health. I would urge all of you to allocate part of your time at least to this segment wherever you practice, whatever kind of practice you do. Because remember, 70% of Indians live in rural areas. As educated Indians and privileged Indians, it is our responsibility to worry about them and care for them. Technology innovation and innovation in other areas. Some of you who have the aptitude for technological tools, you can combine your clinical practice with technology innovation and develop tools that could develop low-cost technology diagnostic tools that will in turn help the fruits of best of technology to the most disadvantaged people in our country and the world. And out of this, you could also get into product development and become an entrepreneur. Nothing wrong with that. You can combine your practice with entrepreneurship. And finally, a very, very neglected area. We never think of advocacy as a powerful tool to protect our turf, to protect our specialty, to protect healthcare, and compete with others for governmental recognition, getting onto the radar screens of the policymakers. And we should be making the policy, formulating the policy, not the bureaucrats. We should be participating in healthcare and eye care planning activity. And I would even encourage some of us who have the aptitude to get into politics and be clean politicians if we can. Bring about a change in the thinking about political life. So in each of these areas, every one of you that are participating in this discussion today have an opportunity. You can do one or a combination of 2, 3 of these things, and you have the opportunity to succeed. The very fact that you have succeeded in getting admission to a medical school and then a residency training program, you are all bright individuals. If you use your talent and intelligence, you can do a lot more than what you think you are cut out for. Just think beyond think beyond the horizons that you are seeing today. So we should all contribute to this concept of universal health, of comprehensive care, that is prevention, treatment, and rehabilitation. And whatever you do, wherever you do, let's commit to quality. Let there be continuity of care to the communities where we go and provide care. Permanent facilities. Take as much care closer to the doorstep of the people as possible. Because this past year at LVP, we had that experience. The first group of our centers to recover to 100% and then went on to 150 to 170% volumes, pre-COVID volumes, were our secondary and primary centers, while our tertiary centers were still inching between 80 to 100%. So the future is going to be in distributed care. More and more people would like to seek care closer to their doorstep. We have to plan our future accordingly. And of course, we have to learn to work with communities. Where communities actively participate in healthcare and education, those communities have high quality healthcare and education. It's my strong belief. And we should be the active participant in those debates and discussions and mobilize people. I just want, I don't know if this video clip plays, but I wish it does. I'm sorry it doesn't. It's a very powerful video. I don't know if any of your technology people out there, Namrata, can help.
Sunil, can you help to play the video? Sunil?
All right.
Can you help?
That's okay. Otherwise, I leave you with this famous quote from J.K. Rowling. This is what she said at the conclusion of her Harvard graduation speech in the year 2009. Your intelligence, your capacity for hard work, the education you have earned and received give you a unique status and unique responsibilities. That's your privilege and your burden. If you choose to identify not only with the powerful, but with the powerless, if you retain the ability to imagine yourself into the lives of those who do not have your advantages, then it will not only be your proud families who celebrate your existence, but thousands and millions of people whose reality you have helped change. My young friends, we all have fit into this criteria. We are privileged, we have the intelligence, we have the capacity for hard work, we have the education. I'm reminded of a conversation I had with one of the High Court judges a couple of years ago. I ran into him in one of the airports and he told me, "Doctor, you know, you're getting wealthier and wealthier each day." I got a little taken aback. Why was he saying that? And I said, "What do you mean?" He said, "I don't know if you ever think, every morning when they open their eyes, millions of people must be giving their blessings to you. What better wealth can you acquire than that?" And I thought that was such a powerful message. Each of you can acquire that kind of wealth and go out into the world. As they say, our profession has a unique advantage. Go out into the world and do well. But more importantly, go out into the world and do good. And our profession provides an incredible opportunity to combine these two, of doing well and doing good. Thank you.